Assalamualaikum doctors. In this video I am discussing a recall video station that is about lymphadenitis. So lymphadenitis, look at the pictures like how lymphadenitis anywhere it can be present. Submental, submandibular, occipital loop. Opening statement should be like school age child with fever and swelling in the neck. So fever and swelling in the neck. DDR, lateral neck swelling, acute unilateral swelling, DD I am telling, like reactive upper respiratory tract infection, streptococcus pneumonia, skin infection, group streptococcus and staphylococcus, then dental infection, anaerobes. Kawasaki disease causes, then cat scratch disease. These are the acute bilateral reactive viral upper respiratory tract infection, Epstein-Barr virus, cytomegalovirus. So Epstein-Barr virus, we know infectious mononucleus we can keep. Then subacute non-tuberculosis myobacterial infections. So tuberculosis we can keep, and Toxoplasma gondii. Chronic or reactive any neoplasia, lymphoma, leukemia, soft tissue tumor, systemic onset of GIA SLE. So the DD is here very important. That is, we can acute unilateral, acute bilateral, subacute and chronic history. Acute unilateral, we are telling that like upper respiratory tract infections, any reactive, Kawasaki disease, cat scratch disease, these are. Acute bilateral are any viral upper respiratory tract infections, Epstein-Barr virus, cytomegalovirus. Subacute are like mycobacterium tuberculosis, and chronic history like reactive, neoplasia, lymphoma, leukemia, soft tissue tumor, and SLE, GIA also we are keeping in the DD of lymphadenitis. Now what are the history we'd like to ask? The history asks as usual onset, course and durations, what increase and what decrease. Any fever, weight loss affecting his activity. Remember, any fever, weight loss affecting his activity. Any neck deviation or torticollis. Shape of the head, any discharge from the swelling, any skin redness, is it painful or not, any contact with cut or scratches in the arm, any other lymph node in any other part of the body, any rashes in the body, bruises, bleeding from body orifices, history of trauma, any cough, shortness of breath, chest pain, night sweating, night fever, vaccination status, BCG vaccine, any dysmorphic features, any other family member with similar condition, history of travel recently. So cervical lymphadenitis, what history will ask? Onset, course and duration, what make it better and what make it worse. Okay. So any all the DD we are keeping in our mind and targeting this question. So tuberculosis we keep fever, weight loss, night sweating, fatigue, then any other part, other swelling, other lymph node present or not. Then conjunctivitis, Kawasaki disease we keep conjunctivitis. Then we go for any cat scratch in the body and cat scratching in the body, then family history of similar conditions, other any neck deviations or torticollis, shape of the head, any discharge from this swelling, any skin redness, is it painful or not, any contact with cut or scratches in the arm, any other lymph node swelling in any other part of the body, any rashes in the body, bruises, bleeding from body orifices, history of trauma, any cough, shortness of breath, chest pain, night sweat, night fever, vaccination status, especially BCG vaccine. So video they showing the left arm, the examiner is looking. So it is a BCG vaccine, any dysmorphic features, any other family member with the similar condition, history of travel recently. Examination would like to do in lymphadenitis. First of all, ABC vitals, hydration status. So ABC vitals, hydration status, very important. Shrunken eyes, urine amount in the diaper, skin turgor, entry fontanelle. Then the general examination for all lymph nodes, axillary, supraclavicular, suprasternal, and groin from other nodes. Skin examination over the swelling for signs of inflammations. Skin examination for any cat scratches, BCG scar. Abdominal examination for hepatosplenomegaly. Testicular examination to exclude the malignancy. ENT examination for the throat and tonsil. So ABC vitals we are doing. We are doing the skin examination for any cat scratch disease, general examination, other lymph node examinations, abdominal examination because hepatosplenomegaly, testicular examination to exclude malignancy, BCG scar we are noticing, and ENT examination for the throat and the tonsil. Now, what is your management plan? Investigations is that urgent investigation. If any of the swelling are noted, so urgent investigation we do any of the swelling are noted, like lymph nodes are supraclavicular or suprasternal, diagnostic and significant pathology. More than 2 cm at 4 to 6 weeks, growing for more than or equal 2 weeks, not return to baseline, less than 1 cm at 8 to 12 weeks. And other signs and symptoms like petechiae, purpura, respiratory compromise, dysphagia, hepatosplenomegaly also need to exclude Epstein-Barr virus, weight loss and night sweat, tuberculosis, malignancy, early investigations, persistent fever more than 2 weeks. So, lymphadenopathy with petechiae purpura, respiratory compromise, dysphagia, hepatosplenomegaly, weight loss and night sweat, persistent fever. To be lab, we are doing full blood count, blood film, ESR, CRP, LDH, liver function test, only if suspected viral infections, serology for toxoplasma, cytomegalovirus and Epstein-Barr virus, culture and sensitivity from the discharge if present, blood culture sensitivity. So, full blood count, ESR, CRP, culture sensitivity, liver function test, any serology, what do we think? Chest x-ray we can do for hilar lymphadenopathy on chest x-ray, refer for biopsy for suitable nodes. Then hilar lymphadenopathy significantly increase the likelihood of the neoplastic disease. Ultrasound of the scan, if acute lymphadenitis, high sensitivity and specificity for abscess formations. In chronic lymphadenopathy for assessing the size, architecture and vascularity. CT only if suspected deep neck space infections. Discuss with the ENT for biopsy in certain situations. Number 1, atypical mycobacterial infection. Number 2, features highly suggestive of neoplasia, like lymph node more than 2 cm in diameter. All supraclavicular and suprasternal nodes. Constitutional symptoms, hepatosplenomegaly and generalized lymphadenopathy. That is ENT biopsy. Discuss. Treatment systemically well and not less than 2 cm. No treatment. GP follow up with. So if the systemically the child is well, less than 2 cm in diameter the lymph nodes, no treatment. GP follow up in 2 weeks. If acute, co-amoxiclav oral for 48 hours. If improve, continue for 10 days. If chronic, more than 6 weeks, co-amoxiclav for 2 weeks. Still result of investigation appear. And atypical mycobacterium ENT referral for surgical excision. Atypical mycobacterium ENT referral for surgical excision. So this is treatment if the child is systemically well. Acute, just we do the GP follow up for 2 weeks. No treatment. If acute, but co-amoxiclav for 48 hours. If improve, continue 10 days. But if chronic, more than 6 weeks, then co-amoxiclav 2 weeks till investigation appear. And atypical mycobacterium ENT referral for surgical excision. So this is all about lymphadenopathy, lymphadenitis video station. Thank you.